Access to healthcare is a huge challenge. With only one doctor for every 10,000 people, many in rural areas rely on an army of community healthcare workers. But with long distances to travel, poor roads and limited transport options, these volunteers struggle to meet the population's need. I'm Dr. Javed Abdulmunem in Kisumu, Western Kenya, where a new scheme is making healthcare speedier and more efficient. This is one of Kenya's poorest regions with high rates of HIV/AIDS, malaria and child mortality. Community health workers are usually volunteers with basic medical training. They perform vital frontline tasks like checking whether children have been immunized, spreading health information and referring patients to hospital.
In this our community, we have around 16 villages, and these our households keep on increasing.
Total population, it's just broken the 12,000 people mark. So who do you have sort of medical professionals dealing with 12,000 people?
Okay, we have one doctor.
Yeah. One doctor?
Only one doctor.
It's obviously there, you know, ever-improving rates of immunization, but still a little bit more to do.
Where the number is below is the challenge that we got about the means of transport and whatever, to move from one household to another, or to move from one homestay to another.
Here we are, busy, very busy.
The solution is simple. Equip the healthcare workers with bicycles.
Clifford.
Pleasure to meet you.
Hello, how are you?
I'm fine.
Thank you for having me.
Yeah. CooP-Africa came in with a project called Bike4Care, and this project aims at giving community health workers bicycles so that they can easily access the households and also easily access the hospitals.
The Cycling Blue workshop can recondition 50 to 60 second-hand bicycles in a week.
Okay, another number 8, fantastic. I feel like an orthopedic surgeon right now, using some nuts and bolts and screws, and so we're actually giving this bike a new lease of life. So this is our red and white healthcare bike.
Yeah, this is the bicycle when it's complete. This bicycle, apart from just ferrying the community health worker to the hospital and to the households, you can also attach it to a bicycle ambulance.
There it is.
Yeah.
Oh, wow.
Yeah?
Here we are.
Yeah, so you can actually sleep.
I think that's actually
So like I told you earlier, you can take an expectant woman to hospital. Most cases they use a bicycle or a motorbike, or at times they even use wheelbarrows.
Really?
Yeah.
Wheelbarrows to transport patients?
To transport patients,
I think this is better.
Yeah.
Slightly treacherous. And we're actually finally delivering these bikes to the dispensary in near Lunya.
Yeah.
Near Lunya. About 5 kilometers.
Madam Mildred Ogola.
With the delivery of the bicycles, the issue of people not accessing healthcare services for HIV treatment and TB treatment will be a thing of the past. Don't we? Yeah. Is it?
It is a good one.
It's a good one?
Actually, it will make the work easier now. Let me try it.
Yeah, go for it.
Yes, let me try it.
But before they head off, inevitably, there's some paperwork to get through.
Oh, look at this question here. What distance do you cover doing home visits in a day? And you've written on Monday you cover 12 kilometers. On Tuesday, 14.
On Wednesday, I covered 10.
10.
Yes. And then I'm going to Actually, there's a caregiver that I promised that I will visit that caregiver today.
Why do you not use the term parent?
We have orphans because of the HIV/AIDS.
I thought so.
Yeah, that infection. It came and then so many parents, they succumb to the disease. So we use caregiver as a general term.
When Kennedy gets a call, he's got to go.
Going to the left?
We head to a village a few kilometers away from near Lunya.
What did she say?
And that she wants a T-shirt.
She wants a T-shirt.
I want to buy a credit here. I want to buy some credit.
As well as working unpaid alongside his regular job as a welder, Kennedy has to cover essential costs like phone credit.
I have to assure her that I'm coming.
Right here.
We want to build trust. If you don't make that appointment, then you have breached the trust.
Right.
Lena, mos kuom ketirito. Yo nyalo donjo kar Baptist ka.
Being local, these healthcare workers are known and trusted by their patients.
And this is your own community? You live around here?
Yes, I come from down there.
Yeah?
Yeah.
So in fact, you might have known lots of these people before?
Yes.
And why did you become a health worker?
Actually, my sister died because of HIV.
Oh, I'm sorry. That's why you became a health worker?
Yes, I said that I need to help my people. I need to help
understand that.
my people because actually many people are dying.
With an average life expectancy of under 50 in this region, adults are often left caring for a large number of family members. A key part of Kennedy's role is supporting these caregivers. Today, Kennedy is visiting Lena, whose sister is in hospital after an operation for cervical cancer.
How are you?
I'm fine.
Thank you for having us.
Okay.
First, Kennedy checks the health of the absent mother's children.
Also, he looks like he's looking for anemia in the inside eye of Eunice there.
A lot. Eunice ate ugali and vegetables. So she's telling me that she ate ugali and vegetables and now she's satisfied.
Excellent. She's got a full stomach, huh?
Yes. With them, they don't have any problem that I can say that this one needs my attention so much or needs referral, but I can see that they're healthy. They're healthy.
The children's mother, Emily, is due back from hospital tomorrow. Kennedy will need to return regularly to check her progress.
So how is she doing now?
She can walk slowly, but by handling her.
Yeah, if you get hold of her.
But she's still weak.
If she's discharged from the hospital and back home, then I'll just make a frequent visit in this house. Yeah, so that I may see how the wound is healing, how she's improving, and then if there's something that we can do to help her or regain strength, then.
All this going and coming, you would do on the bicycle now?
I can frequent myself as many times as possible because I have something that facilitates my movement.
I'm very proud about the bicycle. It will ease his work because sometimes I feel like giving something like transport, but I don't have.
No, you don't have it.
Yes.
Okay. Oh. It's a caregiver?
No, this one is my mom.
Oh, it's your mom. I'm in near Landa, and I think I'm expected by 2 community health workers who received their bikes about a year ago. Hello.
Hello, I'm Pauline.
Pauline, hello,
Yes.
I'm Javid. And
I'm
this must be
Mira. Nice to meet you.
How are you doing? Here we go. We've got a few minutes before the rain comes, apparently. It looks very ominous.
We can visit 10 clients in a day.
Wow, how many were you visiting before the bicycle came?
Before the bicycle, we can, if more, only 3.
Only 3? The patients that Marib and Pauline visit are bedridden patients, and they're stigmatized by the HIV. So they're HIV-positive patients who are at the end stage of their disease and who have no support network. And that's what these community health workers do.
Some can't take even the drugs the way the doctor directed. So we go there, we first boil water and wash the mouth.
But the main thing is they don't want to take the drugs because of they don't have something to eat.
Because they don't have something.
Yes.
The prevalence of HIV/AIDS in this region is 14%, twice the Kenyan average, and 80% don't know they have it. This used to be the case for one of the lady's very first patients, Margaret.
The ill was just going on and on and off, on and off. Then I asked her, how are you doing? Have you gone to the hospital to know your status? Then she said no. Then I tell her, no, just go to the hospital and there you'll get your status.
I went to KDH hospital, I was tested, and I was diagnosed with HIV positive. So I got information on how to stay positively, live positively. I have undergone so many trainings, and that brought me to have hope I really appreciate the two of my friends. They have brought me from far.
I'll teach them.
That was quite close. Is this usual? Yeah? Come rain or shine, we are cycling. Bye, Margaret. Take care. Thank you. Bye-bye. Click. Go on. And another one. Thanks, guys. Thank you very much. I think standing here in the rain is pretty amazing. To think back on the last couple of days I've had with the community health workers, Kennedy and Pauline and Merab there on our bikes, doing what it takes just to deliver the healthcare that's necessary in this these difficult environments. My way home's that way, so I'll be off faster than the rain.
Take your time, girl. Take your time, girl.